and then it'll be saved.
Yeah. Okay. All right, if everyone can see, I will get started. So as Stephanie said, we're here tonight to talk briefly about what neurodiversity is and how to access affirming supports for neurodivergent individuals. This is going to be pretty quick. It's an introduction. If you have questions, hopefully we'll have some time at the end for that. And you've got our email information and other information here to reach out to us if you would like to. I think we do at least, and if not, we can make sure you can get it. Okay, so I'm Dr. Jaclyn Halpern. My pronouns are she, her. I'm a licensed psychologist in Maryland, DC, Virginia, and Delaware, and the co-founder and director of the SOAR program for psychotherapy and testing at Washington Behavioral Medicine Associates in Chevy Chase, which is a big mouthful. I'm also the special ed committee rep for Bell Elementary.
And I'm Laura, pronouns are she, her. I am a licensed clinical professional counselor in Maryland, a licensed professional counselor in Virginia and DC, and a registered play therapy therapist supervisor, as well as the owner of Playful Therapy Connections, which is a virtual practice in Maryland, DC, and Virginia. So we all know that language is incredibly important, especially for those of us dealing with IEPs and 504s. And it can help frame our experiences and our perspectives. So we want to start with the definition. That's really the foundation of what we're here to talk about. So Dr. Nick Walker, who's a queer autistic scholar, educator, and author, defines neurodiversity as the infinite variation in neurocognitive functioning in humans. And she asserts that this diversity is a biological fact of our existence. And as with all other species, humans are inexorably linked to biodiversity. We also want to talk about two models of disability, the first of which is the medical model. So People with Disabilities Australia defines the medical model of disability as viewing disability as a health condition dealt with by medical professionals. People with disability are thought to be different to what is normal or abnormal. Disability is seen to be a problem of the individual. And from the medical model, a person with disability is in need of being fixed or cured. From this point of view, disability is a tragedy and people with disability are to be pitied. The medical model of disability is all about what a person cannot do and cannot be. In contrast, the social model sees disability as the result of the interaction between people living with impairments in an environment filled with physical, attitudinal, communication, and social barriers. It carries the implication that the physical, attitudinal, communication, and social environment must change to enable the people living with impairments to participate in society on an equal basis with others. So if we circle back to Dr. Walker, she also explains the neurodiversity paradigm, of which there are three fundamental principles. So first of all, neurodiversity is not only natural, but it is valuable. Second, it's just false to believe that there's a single type of brain that's healthy or normal. And third, neurodiversity provides for the expression of social dynamics that are similar to those that we see in other forms of human diversity. So this is where we have the social power inequalities that let ableism flourish, and where that same diversity, when actually celebrated, can offer great creative potential. So the medical model is placing the focus on the challenges that those among us who are neurodivergent experience and centers the perception of those around us and their beliefs about how we are experiencing the world. And far too often, schools are doing the same with our kids. So here are just a few of the neurodiversity superpowers that as you're reading them, you may realize, oh, I've got those. My kid has some of those. So one really great example could be having high levels of empathy and feeling emotions deeply. Being able to hyper-focus on a task or a subject that allows you a depth of understanding that is unmatched by your peers. Or you might have had the experience of your kid coming home and saying, my teacher has no idea what they're talking about. And you know your kid's actually right because that's their thing. They've researched it. Your kid really does know. So here's an example of what the autism spectrum actually looks like, as explained by autistic mental health professional Matt Lowry, with the input of a large number of other neurodivergent clinicians. This revised spectrum looks at autism from the social model of disability rather than the medical model. And instead of describing an autistic individual as high versus low functioning or assigning a level 1 or 2, this model really makes clear that the experience of autistic individuals varies greatly across each of these domains. So proprioception, interoception, emotional intensity, communication, relationship, executive functioning, special interests, SIMS and interoception. And these can also vary based on your environment and current supports. So an example of this would be you're trying to communicate with a teacher about what's happening when your child comes home. And they say, well, that's not happening in the classroom. Well, the classroom has a different set of supports, expectations, and maybe something's going on that's causing the kid to not be able to fully express their needs in the classroom. And one other thing to point out here is you can go right to Matt's website. So the link is up at the top, Matt Lowry, LPP.com. He's got some other great infographics, is that it's really important to read content and learn from actually neurodivergent individuals. So my quotes are taken directly from autistic individuals. When I speak about other forms of neurodivergency, I really want to learn from people who are experiencing it firsthand.
Okay, so now I'm going to talk a little bit about the ways we can support neurodivergent individuals. And I'll add in there, when we're thinking about neurodiversity, we're thinking about the range from neurotypical to neurodivergent. And generally speaking, we would think of people with some form of a diagnosis as the neurodivergent population. And there's more that we could get into to specify that further, but we don't really have time tonight, so that's a different conversation. So Laura, can you pop ahead? Thank you. So as parents and advocates for our children, we can begin to encourage a shift of focus. And we can do that by asking some questions. Start by asking, what can I ask of my child's school? How can we shift to changing the environment, focusing on strengths, and moving away from traditional models of reward and consequence? How can we shift language to support neurodiversity? What kind of support should I seek? And then a more controversial question, what about ABA? So I'm going to talk about those questions individually now. Okay, so the first set of questions were, what can I ask of my child's school? How can we shift to changing the environment, focusing on strengths and moving away from traditional models of reward and consequence? The answer is we begin at home, and we start slowly as we see what's working, what's not working, sharing with teachers, sharing with school staff. We may have people helping us through this process through outside support and then internal support through the schools. And we can learn about models of support and begin asking them to do the same thing at school that we see working at home. And so some preliminary resources that really work toward this are Dr. Mona Delahook's bottom-up conversation. She talks a lot about looking at what's beneath the behavior that you're seeing. So rather than starting with the behavior and assuming that a child has negative intentions, we're looking at what's going on below the surface of that. She also focuses on connection and co-regulation. It builds a lot on Ross Green and Dan Siegel, who have their own kind of set of processes that they use. Dr. Ross Green uses the idea that kids do well if they can. If they can't, it's up to us to look for what's going on, to shift our lens and see again what's getting in the way. And he often talks about lagging skills and uses something called the collaborative and proactive solutions model. And then you've got Dr. Dan Siegel, who a lot of people know about. He's a big researcher. He's written a lot of books. He works with Tina Payne Bryson quite a bit. And they've created a model called Connect and Redirect, which is part of the no drama discipline conversation. We can go on from there. The next question, how do we begin to change our language? So we can begin by listening and learning from neurodivergent voices. People will tell you how they want to talk about themselves. They will tell you what kind of language they prefer. And of course, this is going to vary individual to individual. For example, a lot of ADHDers prefer ADHDer. Autistic person, where we're actually going with identity first language, which is very different than I know I was taught in school and what the general population of mental health providers were taught. Thinking in terms of strengths and support needs, as opposed to thinking about how do we change this individual to be more neurotypical. and by presuming competence. And we gave you some sample resources that are wonderful for understanding, in this case, autism, ADHD, from the perspective of an individual who is autistic and is ADHD. There's a lot of other resources out there as well. Question 3, what kinds of supports should I seek? The reality is there's no one-size-fits-all treatment approach, and it's important to recognize that a person does not necessarily require treatment just because they're neurodivergent. So when accessing supports, you want to think about the whole person. You want to engage the individual, and if they have a family or other support system who can help them, to really participate actively in what they're seeking and what would be positive in terms of their growth. What do they see as their own needs and desires for change? We want to look at ways that we can change the environment to support the individual rather than looking at just how to change the individual. We can work on improving communication between neurotypical and neurodivergent individuals and realizing that both ways that their brains work are just fine. We just need to get them communicating in a way that works so that they can understand each other. And we want to focus on connection rather than rewards and punishments. So kind of a brief overview, and obviously this is very, very quick. We talk about ableism. Ableism in the context of neurodiversity is the assumption that a neurodivergent individual is somehow less than a neurotypical individual. It's based in the medical model, and it pushes for the neurodivergent individual to change and be more neurotypical. So ableist therapy focuses on neurodivergent people achieving clinically normative outcomes at the cost of dignity, masking, and camouflage, violation of body autonomy, and emotional and physiological harm, or psychological harm, rather. When we think about respectful therapy, it presumes competence. It recognizes personal agency, as I was saying before. What does the individual need and want? Self-determination and self-advocacy, regardless of the form. It focuses on getting neurodivergent people what they want and need, and it engages the individual through interests and focuses on areas of identified distress. So then we think about testing. A lot of people are looking for testing that's neurodiversity affirmative, and it's very, very hard to find. So what should you look for if you're looking for testing? Testing that takes a strengths-based approach, testing that helps the individual better understand brain, and identify supports that address vulnerabilities, highlights and explores strengths that can help overcome or balance out vulnerabilities, and leads to paths for hobbies, careers, relationships, and general well-being. It's often very much focused on what the individual identifies as a concern. It helps the patient identify positive mirror traits that outweigh the negative aspects of the vulnerabilities, like Laura said, the superpowers, and it frames differences in neurodiversity rather than focusing on deficits. So difference rather than deficit. I think I'm getting a little low on time. Stephanie, are we okay? Let's see. Good to keep going, Stephanie?
Yeah, we're totally fine, totally fine. Thank you.
Okay, all right, good. So then what might respectful psychiatric care look like? If that's something that you and your child wish to consider, you want to look for care that considers the whole person, that looks beyond medication and considers diet, exercise, sleep, may look at genetics to inform underlying differences and potentially inform medication efficacy. You might consider things that are more in the area of brain modulation like TMS, neurofeedback, ETNS. And if medication is used, it's used to assist with distressing and unwanted symptoms like anxiety, mood fluctuations, irritability, and impulsivity, not simply because someone is neurodivergent, but because these things are bothering them day to day. And then we think about a team approach. Neurodivergent individuals are often best supported by a team of affirmative caregivers and providers. So that might include testing, therapy, medication management, but also occupational therapy, speech language therapy, PT, tutoring, any number of things. In each case, seeking affirmative care is crucial, and the care needs to be intended to increase comfort, facilitate communication, support individual differences, and reduce unwanted and uncomfortable symptoms. So very quickly, a word on ABA. So as I said, ABA is very controversial. One problem with the rewards and consequences inherent in ABA is that often children end up shamed. The idea that kids do well if they can suggests that if they can't, punishing them is only going to increase their shame, and even offering rewards that they can achieve can be shaming. In the classroom, rewards and consequences can negatively single out neurodivergent students. The other kids notice when another child is not getting the reward that everyone else is, for example. ABA also destabilizes a kid's sense of connection to caregivers when rewards and consequences involve giving or taking away time with them. And so when we think about the models that we shared, they're very much focused on connection instead.
So all of this is to say that our goal should be to get our kids to adulthood without them having to undo years of masking and having to heal from the trauma that can come from being a neurodivergent individual in a society that has erroneously concluded that neurotypicality is the standard by which we should all be measured. Please enjoy the appropriate meme. And if we have some extra time, we're happy to answer some questions. And for anybody who didn't hear, we are going to make these slides available, and there's going to be a recording. And so we're pretty easy to get in contact with if you need anything.